Good evening and welcome to the program. COVID-19 has shed a lot of light on the troubles in our healthcare system. I was fortunate enough to read a book by Dr. Olive Kobsinje, and that book paints the picture of what we see today. While Dr. Olive is not at the moment in clinical practice, her research allows us to see what's before us, to think hard about it, and possibly to also act on it. She joins me on the show today. Dr. Olive, it's a pleasure to have you here. You're very, very welcome to the show.
Thank you. It's a pleasure to be here.
Right, just for a bit of introduction, Dr. Olive is an author. I've read, I think, 2 of your books. I don't know if there are any other books that you have that I haven't seen yet. And your most recent is
medical one.
Sorry?
I said medical ones.
Oh, no, not the medical ones. I'm not going to read those. But the most recent one I've read is The Patient, this one. And Dr. Olive, I just wanted to say thank you for writing this book, for all the research that you put into it. It really is an eye-opener. Dr. Olive is also a senior research fellow at Makerere University School of Public Health. So let's get into our conversation. Have you reread the book? It must be very different from when you're collecting all this research, putting all this stuff together, and then writing it, and then reading it, and then thinking of the situation that we are in, and then reflecting on your own book. When you think about all of that, where is the difference and what strikes you the most?
When the book first came out, so the pandemic started not too long after the book had come out. And then, people who read it kept saying, how could you have foreseen this? How could you have foreseen this? And a lot of the things that I had written in the book that had to do with the dysfunction of the healthcare system, with underinvestment into this system, were now obvious. People hadn't looked in those places maybe, or would have just looked in passing. And suddenly I think it just hit home. So I remember somebody, I think it was Yusuf, who said, you are some sort of prophet. So on the one hand, I felt like, okay, so at least people begin to see that this is no exaggeration. But on the other hand, I thought, oh, what a shame that we couldn't have fixed some of these things before. So I think most of what has unfolded has really just been confirmation that, all of those things, the dysfunction and so on, are real.
When you say it like that, a lot of what you wrote in The Patient has played out with the pandemic, and you've said that yourself as well, especially in this second wave that we're in. Do you feel vindicated and by looking at all of what's happening and what was in the book, and people just not taking our healthcare system seriously before this?
I recall when we were going to have the launch, I invited, senior people in the Ministry of Health. I actually invited all the ministers of health, the permanent secretary, directors, and I think one commissioner showed up, and the rest of them didn't even acknowledge my invitation. I had given them free copies of the book, and nobody acknowledged, none of those people acknowledged what I had to say. I don't know if they have gone back and read the book. But in some way, you have to say a lot of people knew what I was saying to be correct. A lot of people would probably have wanted to write this book. So really, it's all there. And we just needed to, just acknowledge that we had dropped the ball and we needed to do something to change it.
In your book, there's a line that says, to be fair, there were already attempts to try and get the health of Ugandans in shape. I don't know if you remember that line. Well, you must remember it. You wrote it. Where do you think we are now? Are there still attempts to get the health of Ugandans in shape?
So those attempts have always been there, and by different layers of people, different players in government and outside of government, if you will. However, some of those efforts are really feeble, and some of them are token, and so you don't really take them seriously. I think that line actually comes shortly after I talk about the findings of both of UNICEF and the World Bank, and showing that our healthcare system, not just our healthcare, our social services had really failed the population, and that our children were in dire straits, that investment in our children, in the population, was so low that a child born, I think it was in 2018, here in this country would achieve only 38% of their potential. Now, that is really grim. So if you say, well, attempts are being made, yeah, sure, every year there's a budget that is allocated to health. How much of it compared to the priorities that we have and compared to the magnitude of the challenge for health? So those efforts are there. They are always feeble, they are grossly inadequate, they are token in many ways, and it explains why we have the results that we have.
Do you think that we are right now paying the price for a dysfunctional healthcare system in the wake of COVID-19?
We definitely are paying, but I think we are not learning the lesson. That for me is the most frightening thing. So when COVID hit, most of us thought, okay, so this is a wake-up call. So people are going to realize that we've lost time, we've lost decades, we should have been doing more, we should have invested more in our healthcare system. And now we really have to run. We have to run where others are walking in order to even be halfway there. And initially, I think there was that kind of response that, oh my gosh, we need to hire more health workers. We need to look at the state of our hospitals. We need to re-equip them. I think initially there was that sense. And then in a very short period of time, we settled back into business as usual. And so you started to see all manner of disjointed activities and budgets going here and there are not going in the right places. I think we've slid back into the same, mode where things happen and we only look out for ourselves in a small bubble, and we forget that Uganda has 40 million people, many of whom have absolutely no access to the services we're talking about. And I fear that we might lose the opportunity that we had to learn from the pandemic, to learn lessons and to really take advantage of it.
Last year, there was a call for Ugandans to participate in making contributions to the fight against COVID-19. And lately on all the social media platforms, there are a lot of the Ugandans just complaining about, listen, we gave you that 10,000 shillings that you asked for, or people donated this amount of money, people sent in this. What should accountability for Ugandans look like? And not just from the contributions they made for COVID-19, but also because our healthcare should not be a thing that that comes into question only when there's a pandemic. What should accountability look like for us?
So accountability, sometimes in Uganda, we think accountability is showing a receipt that, yes, this is what I bought. You gave me 20,000 and I have a receipt that reads 20,000. That is usually a cop-out. So the best accountability is to actually have whatever it is that you are supposed to purchase in place, irrefutable. So if you said, Olive, go and put on a party, and you came to the party and I had a venue, I had a singer, I had food, you would hardly need receipts. You would know the party happened. On the other hand, if you gave me the money and you weren't quite sure that the party had happened, you might want to see those receipts. You might want to see photographs. Did people come? The best accountability would be to say all of the patients that needed care did get care. Nobody lacked transportation. Nobody died on the road to the hospital. Doctors didn't catch the disease because we protected them adequately. That is the best accountability. So even if we were to produce receipts now and say, oh, and this is what we paid for, if it's not seen for real that patients are actually getting care, that when they need beds, the beds are there, that when they need oxygen, it's there, that's the accountability that people want. People don't want to see a piece of paper that says we paid so and so to install oxygen concentrators. No, they want to see the oxygen on their patients. They want to see patients get better and walk out of the hospital.
Dr. Olive, with the first lockdown, with the first wave, we saw the lockdown come into play. Do you think a lockdown was the answer for the second phase that we are in? And do you generally see lockdowns as the solution to what our current situation is?
Well, yes and no. So lockdowns have their place. And I think the president explained it very well at the beginning. He said, when you're in a situation where you perceive danger, you want to stop and understand where exactly the danger is and how you're going to deal with it. And so the idea that we have a main virus going around, we think we really can't pinpoint where it's at this point, and we can contain it in those places. So we want to stop transmission. And the best way to stop transmission at this point is to let people stay, to not move around. And while that is happening, we have to have a goal for this lockdown. It can't just be that, okay, so we stop and the virus stops. And when we move again, the virus moves because we are moving it. No. So if the idea is that when we stop, then behind the scenes, while people are in their homes, we are recruiting more workers. We are putting in those extra beds, those oxygen delivery systems. We are making sure that all the medicines, the supplies are in place. We are preparing ourselves so that when people get out, at the very first sign of danger, we are on top of it. That is what a lockdown is for. So for instance, now in the second lockdown, if we had the vaccines, and if we said, while people are in lockdown, this is a logistics thing. It's not even a health thing. It's where do we put, so we have vaccines, we know how many people we need to vaccinate, and we are going to make sure that all these vaccines go in the right places and people do get vaccinated. So now we have a plan, and we can say, when we've vaccinated this percentage of our population, we can now begin to allow people to come out because we know there's sufficient protection. Unless we do that, a lockdown is just what it is. It's people stay in their homes, they are very anxious, they don't have enough to eat, they're actually fighting against the lockdown, not quite cooperating with it. And so the success of the lockdown might actually be questionable because we don't have a specific goal. What are we trying to achieve with this lockdown? Is it because we want vaccines to go out and cover so many people? Is it because we want to put medicines in all these places? Is it because we are trying to recruit? What is our goal? What are we doing with the lockdown that will then justify the lifting of the lockdown? At which point are we going to lift the lockdown because we have accomplished our goal with those days that we had the population lockdown?
Right, thank you very much, Dr. Olive. We're going to take a short break and we'll be back. Welcome back. Thank you for staying with us. We are coming to you from different locations. I'm coming to you from my home, and Dr. Olive is also coming to you from our home. Looking at what we'd just spoken about before we took a break, when you think about countries like the US, Italy, India, when you think about, that side of the world, we assume that they have better healthcare systems than we do. And so we assume that they should have handled the pandemic, in a better way. They have these top-notch hospitals and so on. Why are we not really in the same situation, but why are they also suffering like we are?
One of the reasons, of course, is that the pandemic was totally unexpected, and so there was a lot of scrambling to find a plan to deal with it. Now, many countries that have robust healthcare systems also have plan for unexpected things, plan for situations such as epidemics, maybe not pandemics, but epidemics. So they do have those plans, but the plans can also get overwhelmed if they were not thinking in those kinds of, the sheer size of the problem. But if you think about the United States, it doesn't necessarily have the best of healthcare systems. It is a very inequitable society. And even within that very rich country, there are lots of people that don't have health insurance, that do not have access to as good healthcare services as we might envisage. So I think with the healthcare systems, we have to think about how equitable are they? How prepared are they to look after not just a few people, not just the wealthy, but everyone in the population, because that's what a pandemic does. That's what a highly contagious illness does, is that it sweeps through the population. And so those that have and those that don't are all going to be in need. And unless you protect everyone, you actually can't protect a small number of people. So America found that it had to protect those that had absolutely no health insurance, would have been excluded. But how do you protect the wealthy, the well-insured, without protecting those others? Because these people, they are your bus drivers. They're the ones cleaning your stations. They're the ones delivering food. They're the ones. So you really have to, this is where it pays to look after everyone and not just a few people.
That's right. Thank you for that, Dr. Olive. When you were speaking, I was thinking about, especially earlier, when we speak about the lockdowns, usually my mind runs to mental health. It runs to how people are coping in these times, locked up in their homes. I think when there's no lockdown, you're busy, you're running up and down in the office, you're in a taxi, you're doing all kinds of things. But now you're forced to go home, sit down and acknowledge life, acknowledge what's happening. But even without thinking about the lockdown, just COVID-19, the thought of it, the way it's affecting us, the way it affects children's mental health, the way it affects just about everybody. I'm curious to know what you think about how we are handling this situation in light of our mental health.
Right. So mental health problems have been anticipated in this pandemic, and indeed they've played out. The fact that something is coming at you, it is out there, you don't know what it's like, you don't quite see it, but you know it's monstrous, it's killing people. Now, to compound that, you lock people up in their homes so they don't have access to the usual distractions. As you say, if you're moving about, there's some distraction, but right now maybe you don't have a job, maybe you don't have an income, you're in your home, you're trying to figure out how you're going to survive this period. That can be very stressful, not having the resources to cope and not knowing how long this is going to last. So in some ways, the pandemic has set us up for the worst possible scenario without giving us relief, without saying, okay, if you just put your head down, at the end of 3 weeks, you will come out and it will be okay. Nobody knows when this is going to be okay. And it's just as we think it's going to be fine. No, it's not, it's worse. In fact, some of the people who have suffered the worst mental health problems are in the medical fraternity. There have been suicides. It's being tracked now in some countries where health workers that have been at the front line are suffering depression, clinical depression that needs treatment. There have been suicides, as I've said. And it's about, maybe you're overworking, maybe you're always worried about getting the virus and transmitting it to your family and not knowing how they're going to cope. Maybe you've seen too many patients die. Maybe you've lost relatives, you've lost friends.
What does help look like for medical workers and other frontline workers who have to face this situation head on, for example, and just have to keep going? Every day you just have to show up at work. Every day, you lost somebody yesterday, your patient yesterday, and tomorrow you're back at the job and you're back in the same room where they died with a new patient who is also very critical. What does help look like? What does mental health look like for them?
So again, it's a very stressful situation. I talk to my colleagues who work in those spaces. And initially, of course, they also had the same fears as the rest of us, that, of catching the disease, of it turning out that the patient that you've been suctioning actually has COVID and all of those. But I think at the beginning, it was like, it's going to run for a few months and then it's going to be over. And then it hasn't been over. And many of them have had to do longer shifts because they are fewer. Maybe some of their friends don't have transport to a hospital or are unwell themselves. But Josephine, there's a new, and it's not new, it's just become more obvious recently, threat that when health workers fall sick themselves, they might not get the care that they need. That health workers that are constantly treating other people, when they fall sick, whether it's COVID or some other illness, this health service is not going to come up for them. That they might not get that bed they need in the ICU, they might not have oxygen, there might be no specialist to see them, they might not be able to afford the bills. This is a really frightening prospect for many of them. and for their families to know that your mother goes out to work every day, but if she should ever fall sick, you better have the money because the healthcare system that she works for is unaffordable. This is a really frightening prospect. And I think unless we can address it, the healthcare of health workers, there's going to be a problem.
I hear Olive. I've been thinking about the information that we put out on COVID-19 that the Ministry of Health is putting out and so many other players in the industry. There's the urban and the rural disconnect, and I would like us to talk briefly about that. And even before we do that, maybe let's define what we mean when we are saying healthcare, a healthcare system. What are we talking about?
A healthcare system. Well, so first, we have to say it's a system. It is not just units here and there and everywhere not working together, but it's something that is planned and orchestrated to work together so that every unit has a role, a responsibility, and it knows how it plays into the next unit and into the next unit, and that they all work closely together to deliver an objective, in this case, healthcare. So for instance, we have different levels of health units, from the smallest health center to the National Referral Hospital that offers the most sophisticated care. We have different kinds of pharmacies that, would dispense different types of medicines, or drug shops. We have a referral system that determines, okay, if this patient is seen here and this facility can't manage them, how do they get them to a higher level facility? So all this is planned and orchestrated. But it's not just about treating people that are sick. The healthcare system also looks after people that are in perfect health, ensure that they don't ever fall sick. And this is one of its critical components, the preventive aspect, that you should not just see healthcare when you are sick, that it should be working in the background to ensure that you eat well, you exercise, you take your immunizations, you get your annual checks if that's what you need, so that you avoid being in that group that now needs treatment. So unfortunately, what's happened over time with the rural and urban disconnect is that in the rural areas, there are all these health centers that have been set up over time. And many of them are really not delivering what they say they should. Sometimes they are closed for days on end. Sometimes they're open one day a week and the medicines come and they're taken out and there's no medicine. So the person running the clinic has no reason to open. They close the clinic and go home again. You have all manner of drug shops in there. Nobody knows what kind of drugs they sell, if they are not expired, if that person that's handing you the medicine has the license to give you that kind of medicine. That is not a system. You cannot say you have a system where all these units are working independently and you don't have a good sense of what exactly they are doing and what they are delivering on. So then you have people in the urban centers that think they have a system because they are surrounded by hospitals. They can go to this hospital, that one, the healthcare, the pharmacy. They have 3 pharmacies within 500 meters of their doorstep. And they cannot tell you exactly what service they can get at any of those places, because maybe that service is not there. Maybe the CT scan is not working. Maybe the surgeon is away. So that is not a system. And I think we need to develop a system that works for everyone, regardless of whether you live in Kanungu or you live in Kololo.
There's this question of where do I go when I need, for example, emergency healthcare or just general healthcare. So people are going to advise you and say, go to a government hospital. Go to a government hospital, they will take care of you because the medical personnel there is trained and all. Somebody will say, if you go there, you're going to die. Please go to a private facility. At least you find someone will say, go to the government because the nurses might be very rude and very, the doctors might be arrogant, but they know what they're doing. If you go to the private, they'll charge you so much money, but you will die. It feels like we don't know where.
Oh dear.
So you're looking for a kind doctor or you're looking for treatment. You have to choose something. You can't have both of them. You can't have somebody.
No, you can't have a nice room. You can't have a polite nurse and a doctor that's right there and in one facility. Where do you think you're living? No, I'm joking.
It's impossible. And I would like
But
to hear your thoughts on that.
it-
Our healthcare system doesn't seem predictable at all because we don't know where to go.
yeah, maybe because it's not a system. That's what I said. So if it were a system, you would know how to access this. So how do I get into this system and how do I get out? And the idea, I think, is that you, with this access thing, is that you go to the closest health center, and the closest health center will take a look at you, determine if they can treat you there, and if they can't, they'll refer you to another facility where you have a better service, so you have the kind of service that you need. Unfortunately, this is not how it works. We don't have a referral system in this country. And so all these units are working together, are working independently. In theory, they should not be working independently, but in practice, because they are not set up that way, the health facility might decide that they really can't manage you, but you're on your own. Go and maybe go to another hospital. How do I get there? Do you have an ambulance? No, we don't have an ambulance, but we can call one and you will pay them. That is not a system that works for everyone. If we think about the healthcare workers that are at those different levels, so for instance, a health center 3 that has maybe a nurse, midwife, and I don't know, somebody else. These people should have the level of training and supervision and mentoring that allows them to make a quick assessment of the patient and determine that I can manage this patient here, or no, I can't manage this patient here. This is how I'm going to prepare them for the trip to the next level. They need to go to a health center 4. They're going to find a doctor, an anesthetist, and an operating room, and they're going to be able to take care of them there. And they should be able to call and say, we are sending over Miss Josephine Kalunji, who needs this kind of care because we can't manage her here. We are putting her on these fluids, on this medicine, and there she comes. Prepare for her. I'm sorry, this is not happening. We need to plan for it to happen. We've seen it in COVID-19 that people don't, even in the midst of this level of crisis, people have no clue. So where do I go? Who do I call? Who do I call? We all have cell phones. We have cell phones. They are no good a lot of times. You're calling 3 or 4 people to find out where you can find this doctor. But a system is not a doctor. The doctor works with a team. The team works with equipment, with supplies, with pharmaceuticals. All this needs to be planned and orchestrated.
Dr. Olive, we are laughing, and I think people might mistake our laugh for finding.
No. This is most grave. This is definitely a very grave situation.
I'm just thinking about recently I had a patient, and when we moved the patient from one place to the other, when we got to the next place, they said, so we're going to want to give him a painkiller, but what painkiller had they given him the other side? But the other side had just told us, take your patient. So, you have no information. They didn't write any discharge note. They didn't have anything. So when you speak about what a system looks like, then I begin to understand more clearly what our situation actually is. So thank you for that. Let's take a short break. And when we come back, we'll really just be speaking about where do we go from here. And we'll also speak a bit about our healthcare workers. Welcome back. Thank you for staying with us. We are speaking about our healthcare system today, and we're speaking to Dr. Olive Kobsinje. Dr. Olive, this outcry over expensive private healthcare, where did the rain begin beating us? And what role would a functional public healthcare system have played in all of this?
Thank you. Yeah, so there's been so much talk about private health facilities ripping people off and taking their homes and pieces of land. And it's really been frightening because when someone is sick, they already have enough pressure. When you have a family member that is critically ill, you already have a lot of pressure. The last thing you need is to hear that there's a huge bill coming at you and that there's even no guarantee that that person is going to get better. So it definitely is a crisis. It definitely is a crisis. Unfortunately, when you say, where did the rain start beating us? This did not come up with COVID-19. And I say again, we've been walking this walk, we just didn't want to admit to ourselves. So the Ministry of Health, bless them, they track what they call catastrophic health expenditures. They track what they call impoverishing medical expenditures. So what does your household pay for medical services? What proportion of your income goes to paying for medical services? Because if you're paying, if for instance, you're earning 100,000 and you're spending over 10,000 buying healthcare, and then of course you're spending on rent, on food, on clothing, on education, any extra shilling that goes to medical care is going to drag you back into abject poverty. Now, we live and work in a country where the majority of people cannot really afford to pay for healthcare on their own, personally, without any insurance. And it's been happening for a long time. If you look at the reports from the Ministry of Health, every year they have an annual health sector performance report. It's a public document. You can look for it online. And you see, 39% of households were experiencing catastrophic health expenditures. 40% of what? So how are we expecting people to get out of poverty, to be able to take their children to school, to buy them adequate nutrition, if they are spending that much money on healthcare? Now, as long as it was happening to poor people, people that were living in slums, people that were living in villages, and we didn't see them on a regular basis, and they didn't come to our doorstep, and we didn't share air with them, so we had no risk of catching anything infectious from them, we just looked at it as something in a report, and we moved on until catastrophic health expenditures came to Kololo and Nakasero. And that's when people started saying, what? No, this is illegal. This has been happening to lots and lots of people. People have been selling their cows, their goats. People have been selling their labor for a year to be able to pay for the bill when their wife had a baby and needed a cesarean section. So this is not new. It's new to certain people. It's certainly not new to a lot of Ugandans. Now, one can say that when you have a system, the Ministry of Health exists to determine policy, to determine standards and guidelines, to maintain quality. They have a quality assurance function, and to do supervision across the country. Those are their main functions. So in that policy, in those standards, in those guidelines, ought to be things that protect people against that kind of expenditure. So that regardless of who owns the health facility, people who come to this health facility are able to get the kind of care they need without paying for it with their lives. But seeing as we really do not have those kinds of safeguards, it means that it is left completely to the market forces. And when you do that and you haven't provided, so it's okay, Josephine, if you want to go to the most expensive health facility in town and you're going to pay out of your pocket, nobody should argue with you. But they should also provide a service where, as a taxpayer, you should go and get an adequate level of care, especially for life-threatening, limb-threatening conditions, so that it's not a choice between having this exorbitant cost and nothing, which is what a lot of people in Uganda are experiencing. So right now, in the midst of a pandemic, all of those other things that killed Ugandans haven't stopped. They're still having pregnancies that they might not deliver safely. They're still having malaria, pneumonia, name it. They're still falling off borders and having a crash. And these same people are still going to health facilities where they will pay for their x-rays, they'll pay for their prescriptions, they might even pay for a consult. So unless we have some form of health insurance that covers everyone, that assures them of the minimum basic life-saving care, we are always going to run into this kind of problem.
Looking at the many calls for an increment in salaries for our medical workers, one of our most essential staff, and then some people saying that they are not being true to their call and to the oath that they took because they're more concerned, because it looks like they're more concerned about their pockets. So I want us to talk about that. The fact that, yes, they do need to be compensated for what they're doing, for the danger that they put themselves into to save us, especially in this situation, but also just thinking about how sometimes they are not doing themselves justice by how they carry on. And I just want us to have a frank conversation about that.
So a lot of times the system is really a challenge. You have health workers currently in the pandemic that are walking up to maybe 5, 6 kilometers a day to to wherever they work, and they're going to have to walk back. That's dedication. And they don't have a lunch allowance. They have to carry their own food. They can't afford to now go and buy little snacks because of fear of the pandemic. So they carry their own food. They work long hours. They are not adequately protected. They're wearing the mask 2-3 days. They don't have any shields. They have to reuse their aprons. And they know of another health worker that has contracted COVID and died. So they're working under these conditions. And so you expect a lot. In fact, people always think, oh, they're after money. I know health workers that take the little money they earn to buy thermometers, to buy gloves, because they don't want to be caught without a pair of gloves. This is the way it is. So please treat those people with compassion, pay them decently. A lot of them are really struggling. Why should a health worker worry that if their child falls sick, they are not going to afford their health care? Why should a doctor worry that their son, their daughter can't afford decent education? This is shameful. So if you want a working healthcare system, you want to invest in the people that work in it. And right now, we are not doing a good job.
I hear you, Dr. Olive. And when you say compassion, I think compassion, yes, goes both ways. So when we speak about expecting compassion from the healthcare workers, we should be able to give it as well, especially the people who are able to make a difference for them. In closing, I want us to speak about building a resilient healthcare system, looking at the investment that we're putting in our system. And I would like you to speak about that. What builds resilience?
We need to invest in the infrastructure. We need to invest in the people that work in it. We need to have the right policies. We need to have leadership and financing. Leadership and financing will determine pretty much everything else. It will determine where we put money for training. It will determine where we put money for equipment. It will determine. Currently, Josephine, we are investing as a country. We invest more in military hardware than we do in medical equipment. So we have, I don't know how many jet fighters we now have, but we've certainly been buying a lot of them over the years. We have more fighters than we have CT scans. Now, if you want to build a medical system that works, it's interesting. The country says that we want security. We want to secure the country. It's almost like if you put a very sophisticated burglar-proof and electrified fence on a house, and you have nothing in the house to steal, and your children are malnourished. Like, who are you? What are you protecting? You think anybody's going to break into your house, steal nothing? So we have this huge, in this current budget, I think health got 1.4 trillion and security got 6.7 or 6.9 trillion. Tell me where we're putting our focus. We are definitely not putting it on the well-being of people. So if we're building a resilient system, we want to have the policies that are supportive of that. We want to ensure that we're focusing not just on treating people that are sick, but on keeping them healthy. We want to ensure that the healthcare delivery that we have in place is serving everyone, that everyone is benefiting from it, supporting it, interested in its keeping up. But currently it is only serving a small proportion. And you know what? It's because a lot of the people that make these decisions have decided that this healthcare system that they've built is not for them. It's for other people. Their healthcare system is in Germany, it's in South Africa, it's in India, it's in the UK. And this is for the people who don't have access to that. Now, as long as you have the decision makers not being fully invested in this, and wanting to improve it and wanting to keep it good, then they're not going to pay the bills. Another thing is research. How much money are we putting in medical research? In fact, in research generally, but certainly in medicine. Zilch, so we can't say that because the way you build as resilience is that the research is constantly going on. We have good data systems that advise on what's new here, what has changed, where do we need to put focus. If we don't have those systems, then we buy something, it sits there, year in, year out, it begins to break down, nobody knows why it's breaking down. This is where the problem is. So we need to invest consistently. We need to plan. We need to orchestrate. We need to be sure that all of these parts and then have those data systems and the research that constantly advise us on where we need to tweak, what we need to fix, where we need to go.
Listening to you, Dr. Olive, I think that then the situation that we are in, the pandemic right now, could have informed our budgeting process for the next financial year. But where do we go from here? And focus on where do we go from here? How do we make healthcare more affordable for everybody? What clever things have other countries done that we can copy? And what can we do at an individual level? What can I do as an individual?
Many countries that have more equitable systems have universal health insurance or some form of insurance that ensures that everyone in the country has access to some level of care. So you're not going to get any cosmetic surgery done on you on the taxpayers' money, but you're not going to die or lose a limb. So all these basic life-saving and preventive services are paid for through your taxes. So that is one thing that we need to do. Currently, we don't have it. This is why we have people, selling goats and chicken in order to go and have a baby. The other thing that, of course, people have done is to say, where are the most vulnerable people? So in Uganda, unfortunately, the most vulnerable should be the ones that have a safety net because they will not afford it on their own. But we are cushioning the ones that are privileged. We're saying, oh, so where is the governor and where is the minister? Because they need to go and get better treatment than is available here. So these huge sums of money that we're spending on people that are already privileged really need to go and protect the most vulnerable. Because look, this generation, unless we look after them, they're going to come back and bite us.
My final question to you was, what do we do at an individual level? What do I do as an individual? You do?
There's a lot that we can do as individuals. Certainly, in the pandemic has given us an opportunity to see how we can protect ourselves and how we can protect those around us by being more responsible, by not moving around unnecessarily, by wearing our masks, cleaning our hands, keeping our social distance. But then we forget that, so there are many people who can do these things who are not doing them, unfortunately. But there are also many people that genuinely can't do them. They live in a slum, they live 6 people in a small room, so they cannot distance themselves. And they sell charcoal and bananas on the roadside, so they can't stay home. They go out there and they come back, 6 in a room. So there's a challenge there, which again emphasizes that we need to look after our most vulnerable in order for the whole of society to be well. But on an individual level, again, I mean, there are things we can do about our diets, eating right, exercising, getting ourselves informed. People have smartphones, they have access to a lot of information, but they're spending their time, looking at silly jokes and everything, instead of finding out what it is they need to do to feed their children better, to feed themselves better. So there's a lot that we can do as individuals, or even just finding out, if I was ever ill, which of these facilities around me would I go to, and what would I be expected to pay, what kind of service, so that you are better informed before an emergency happens. You have a plan. We tell people, if you are pregnant, you have a whole maybe 8 months. The first month you didn't know, but you have 7 months to plan how to have the baby. Have a plan. So even without a pregnancy, just in life generally, have a plan. Find out, what do I do? When do I go to see a doctor? And should I go for a checkup? These are all things that we as individuals can do to keep ourselves healthy and to know what to do if we should be unwell.
Thank you very much, Dr. Olive. I've taken up a lot of your time, but thank you for giving that to us. You've given us a lot of insights, and I thank you for that. And I'm just going to tell everybody out there who's watching, I read Dr. Olive's The Patient, and I must say that I see 5,000 shillings there, Dr. Olive.
You didn't see anything?
I found a lot of information in that book, and I think we all need that information. So thank you very much, Dr. Olive. Dr. Olive is an author, senior research fellow at Makerere University School of Public Health, and she has given us quite a bit of information with this conversation. Thank you, Dr. Olive, and I wish you
Thank you very much, Josephine, and stay well.
All right, coming up is NTV Weekend Edition. We've come to the end of our show. Have a good evening.